Today here at Prima Temp, we're excited to have Dr. Clarisa Gracia. Dr. Gracia is Chief of Reproductive Endocrinology and Infertility at Penn Fertility Care. Thank you for joining us here today, Dr. Gracia.
Thank you so much for having me. It's a pleasure to be here.
Now, many of us are aware that age is, the most common cause of infertility, but what other health conditions can cause infertility?
I would say it depends on kind of the population overall. I would say about 40 to 50% of cases, there's some sort of a male factor. So the sperm quality may be low. There's a tubal factor depending on the type of patients that you take care of. It could be in, 20 to 30% of your population. Many of the patients that I see have unexplained infertility or age-related fertility issues. I mean, that is one of the biggest the biggest population we're seeing now. As you delay childbearing, it can become harder for you to get pregnant, and you may, seek treatment and evaluation sooner because of that, especially if you're thinking about your second or third child and you're starting the whole process at 38 or 39.
Secondary infertility doesn't get as much attention as primary infertility, but if I heard you correctly, it's quite common.
It is. I mean, it's common, I think, because of the age factor more than anything else. That seems to be, as women get older and maybe their first child is in their late 30s, and the second child might be harder because the quality of your eggs is going down.
Another thing we hear a lot about at Kendara is PCOS. Would you think that PCOS comes after age-related infertility as one of the most common causes?
So I think about a third of patients. Also, there's a fair amount of patients that also experience ovulatory problems like PCOS. So yes, we see that quite a bit as well. And that typically is characterized by irregular menstrual cycles. Usually the menstrual cycles are spaced apart at least 45 days from the onset of one period to the onset of the next period. There can be high levels of male hormone, and the ovaries have a very specific appearance where they have lots and lots of eggs or follicles within them. So they're not really cysts, but they're follicles or eggs. So women almost have more eggs than is kind of the normal complement. And there seems to be a problem with those eggs getting released in a regular way. So then if you don't ovulate, obviously it's more challenging to get pregnant on your own and to time intercourse.
It really makes sense if you're not ovulating that it's more difficult to get pregnant. But I don't know that it's common knowledge that women with PCOS actually have more eggs than usual. Do the same drugs work for PCOS as with age-related infertility?
So for women with PCOS, typically we would kind of do an evaluation with hormone testing to make sure that is what they have, because women with irregular periods could have other things like thyroid problems. They could be in premature ovarian insufficiency, which means you actually are running out of eggs early. So it is important to get some tests to see what is going on. But if you have the diagnosis of PCOS, and sometimes we check the semen analysis before putting women on medications just to make sure that we're starting medications and there's a good opportunity to actually get pregnant. We typically start medicines like letrozole would be my first line at a low dose, and then you can monitor ovulation through ultrasounds, see if a follicle or egg is being produced, and then help patients to time intercourse.